Good morning, everybody. I'm Simone Ferrero. I'm a professor of hematologist in Torino, the University of Torino, Italy, and I'm presenting a study on Waldenstrom macroglobulinemia. This is a prospective observational study sponsored by the IWMF and by the Italian Lymphoma Foundation. We enrolled 300 patients with the primary objective to demonstrate that a non-invasive diagnostics is as well as the conventional bone marrow diagnostics. We investigated the mediated mutation, that is the hallmark of Waldenström macroglobulinemia, both on bone marrow samples and on peripheral blood and plasma samples. And we demonstrated that a non-invasive diagnostic made only on peripheral blood, so non-invasive without bone marrow biopsy, has the same curability than the bone marrow biopsy. So we might skip the bone marrow biopsy for Waldenstrom patient. Moreover, with a combination of the measured value of mediated mutation in the blood and the immunoglobulin values, we were able to identify patients who are going to receive treatment very soon, in contrast to patients that are going to be followed up without any treatment need for many months or years. We were also able to differentiate the IgM MGUS condition, so the benign IgM MGUS condition, from the Waldenstrom needing treatment by combining the value of mediated measured on peripheral blood and immunoglobulin. And finally, we tested on bone marrow, on peripheral blood, and on plasma, on cell-free DNA, the mediated after the treatment for those patients who underwent treatment with chemoimmunotherapy. And we were able to demonstrate that patients who are still MRD positive, so positive for this mutation after the treatment, these patients have still the disease and are going to have a relapse in the next months or years, while patients who are negative for this mutation, so who responded in blue, who responded very well to the chemotherapy, to the immunochemotherapy, are patients not experiencing relapse. So again, the final message of the poster, of this poster, is that non-invasive diagnostic and non-invasive monitoring of response to the therapy through the mediated mutation measured on peripheral blood is possible, and we do not need any more bone marrow biopsy for these patients.